Network and Knowledge Hub, I would like to welcome everyone to this webinar, 2SLGBTQ+, Inclusive Trauma-Informed Care. I live on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape, and Attawandaron peoples. Please think about the traditional lands you are currently situated on, and join me in acknowledging and thanking the generations of Indigenous peoples who have cared for these lands, and in celebrating the continued strength and spirit of Indigenous peoples. The ongoing work to make the promise of truth and reconciliation real in our communities, and in particular, to bring justice for murdered and missing Indigenous women, girls, and two-spirited individuals across the country should inform our discussions in this webinar and beyond. I'd like to welcome our ASL interpreters from the Toronto Sign Language Interpreter Service. And I'd just like to say that we threw a curveball to them about an hour before the presentation. We learned that we are going to present the presentation in a recorded form and then followed by a live Q&A. And they didn't know that until they joined just a few minutes ago. So we thank them for their flexibility, and we apologize for any compromises this makes in terms of accessibility to our participants. I'm delighted to introduce our speaker for the day, Jenna McKay. And I'll just mention some of the highlights and encourage you to learn more about Jenna from her bio on our website. Jenna McKay works in private practice as a registered social worker in Belleville with a focus on trauma and providing 2SLGBTQ+ affirming support. Her extensive and diversified work in research has focused on trauma, mental health, gender and sexuality, and service access. Most recently, Jenna worked as a research associate with the Dalla Lana School of Public Health of University of Toronto on a Public Health Agency of Canada funded project to develop, implement, and pilot curriculum to increase the capacity of service providers in Ontario working with 2SLGBTQ+ folks from a trauma-informed lens. And as I mentioned, we are going to play a recorded presentation, but I want you to know Jenna is with us, and I think she's on screen now. She's been having difficulties with her internet, and just to be safe, she very kindly recorded her presentation at the last minute, so we would be sure that you were able to hear it or to access it. And we're going to play that recording in just a moment. And again, Jenna will join us for the Q&A when we present your questions to Jenna to hear her responses in the last 30 minutes of the presentation. Jenna, would you like to say hello?
Hi, everybody. Thank you so much for joining us. And just to echo Linda's apology that we didn't provide the recording to the interpreters in advance. So apologies if some information is missed. And I introduced myself more thoroughly in the recording, but thank you for being here and understanding that I live rurally, so internet is not always super reliable. And I'll see you in an hour.
And we're glad you're here, Jenna. And I'll just say, when she says welcome everybody, we had approximately 3,600 people register for this webinar. This tells us of the importance of this topic and the interest and need for information that Jen is going to share. So with that, I'm going to ask Sarah to play the recording of Jenna's presentation.
Thank you so much for joining us. We are so happy that you can be here with us today. And a sincere thank you to the Violence Against Women Learning Network and Knowledge Hub. We're going to be talking about 2SLGBTQ inclusive trauma-informed care. And I want to start just by locating myself. So the land that I'm joining you from has Anishinaabe, Algonquin, and Haudenosaunee roots. And I want to acknowledge my responsibility to respect, honor, and sustain these lands, which includes working to address historical and ongoing colonialism, racism, and oppression of Indigenous peoples, while simultaneously honoring Indigenous peoples' resilience and resistance to oppression. Professionally, I have a background as a psychological researcher. I've done a lot of projects in the areas of gender-based violence and 2SLGBTQ mental health. I'm also a social worker in private practice in Belleville, but have a background doing community work in various not-for-profit contexts and in hospitals. And personally, I am a cisgender woman. I use the pronouns she and her. I am a white settler. I identify as queer and bisexual. I live with invisible disabilities. I identify as a trauma survivor and with lived experiences of mental health. I was raised by trauma survivors. I live rurally and have a working class background. And it's really my lived experience that first drew me to this topic. And then through research and my work as a social worker, has further committed me to the importance of creating more inclusive and affirming spaces that are trauma-informed for 2SLGBTQ folk. So I'm not an expert in this area, although I will share with you what I know. And a lot of this was really developed in collaboration with the people on the slide here. So first, Leah Keating and I, a number of years ago, developed a conference presentation and some webinars related to this topic, which was then expanded upon with Lori Ross, Merrick Pilling, Michelle Tam, and Joselle Gaz to create a one-day workshop. So that one-day workshop was funded by the Public Health Agency of Canada, and we piloted it across Ontario at 12 different workshops. And we recently wrapped up the evaluation in April. A grant has been submitted to revise and scale up the workshop, and we'll hear in June whether or not that was successful. So I am receiving an honorarium for this workshop. Other disclosures are that I was employed by that PHAC project, the Public Health Agency of Canada project. I'm a registered social worker in private practice, as I mentioned, and I am in the planning stages of curating a digital education community on related topics. So as you know from the advertisement, today's learning objectives are to be able to describe the importance and the guiding principles of 2SLGBTQ inclusive trauma-informed care, to increase understanding of trauma as it specifically relates to 2SLGBTQ communities, and to identify opportunities to apply today's learnings to your practice. Our ambitious agenda is to briefly kind of introduce gender and sexuality and then kind of go through those learning objectives I just mentioned. So I've really condensed down what we would do in a day to an hour. And one of the feedbacks from the evaluation was that it would be better as a 2-day workshop. So hopefully everything makes sense, right? I've tried to just kind of keep the key pieces, but this is really an introduction. And if you're familiar with the topic, a lot might be a review, and so I hope that there's still things that kind of inspire new ways of thinking about something or gives you new ideas about how to bring this back to your community. And if it's new for you, I hope that I don't leave you feeling confused. Right? And apologies if you can hear my puppy in the background. So we'll start just by doing a really quick 101 on gender and sexual diversity. And if this isn't something that you are familiar with, I really recommend doing like a more comprehensive workshop. It can be super helpful to become familiar with like the language and different issues facing 2SLGBTQ folks, so that the first time we're experiencing them, isn't when we're sitting with somebody that we're working with, right? That we have a frame of reference. These workshops are also super helpful for getting to know our own assumptions and values and biases. So first, 2SLGBTQ stands for two-spirit, lesbian, gay, bisexual, trans, and queer. It's an umbrella term for folks who experience marginalization on the basis of sexual orientation or gender identity. And it's important to recognize that 2S LGBTQ folks have diverse experiences, right? It's not a homogenous group. People have many different identities and social locations. And so there's really no one size fits all approach. And it's important to bring an intersectional lens, meaning that we take into consideration like the whole person, right? All of the different aspects of their identity, whether it's sexual orientation or gender, race, class, etc. And we place the 2S at the beginning, which stands for two-spirit. I don't know what that was. To really recognize that Indigenous 2S LGBTQ folk were on this land before settler or non-Indigenous LGBTQ people. So first, there's a difference between sex and gender, even though like in mainstream society, it's often kind of like conflated. So sex can be thought of as the social classification of people as male, female, or intersex. Sex is generally based on biological factors like genitalia, hormones, chromosomes. And intersex, if you're not familiar with the term, is used to describe people that were born with reproductive or sexual anatomy that doesn't fit into a binary understanding of gender, right? So like the male and female boxes. And when we think about gender, it's important to recognize that there's a difference between gender identity and gender expression. So gender identity is our internal and individual experience of our gender, right? Our sense of being a man or a woman, both, neither, somewhere along a spectrum. Whereas gender expression is how we express our gender. And so that can include dress or voice, makeup, hair, name, medical interventions. Some examples of gender expression include feminine, masculine, androgynous, and gender identity and gender expression sometimes align. Like I could identify as a woman and have feminine gender presentation or expression, or they might not align, right? Somebody could identify as a woman and be more masculine or androgynous in their gender expression. And it could also be fluid, right? It doesn't have to be something that's static. So quickly defining transgender and cisgender. On the left here, we have a baby is born. That baby is assigned female at birth. That baby, as they grow up, identifies as a gender other than female. That person would be transgender. On the right here, a baby is born. Like me, I was assigned female at birth. I identify as female. I'm a cisgender person. So trans can be used as an umbrella term to describe a diversity of identities that don't align with the expectations of the sex that was assigned at birth. So people may identify as trans, as genderqueer, gender nonconforming, or non-binary, among other terms. And it's important to recognize that trans folks may or may not undergo medically supportive treatments. Everybody's transition journey and how they choose to express themselves is different and all equally valid. Non-binary is an umbrella term for anybody who doesn't identify with the gender binary. And it's increasingly a term that people are identifying with, particularly young people. And it includes people that identify as having an intermediate gender, multiple genders, shifting genders, or no gender. And I know I just defined cisgender, but one thing I want to flag here is that it's really important to use the prefix cis rather than bio or genetic or real. So language is always changing. And I know when I first was kind of involved in some of this work, like in the early 2000s, sometimes bio was considered like, you know, the preferred prefix to use. But what we know now is that these prefixes invalidate trans people's experiences and identities by suggesting that they're less biological or genetic or real, right? Which is not the case. So it's more appropriate to use the term like cis woman or cis man compared to bio woman or genetic man. So switching gears here to look at sexuality, this can be broken down into multiple components. There's our behavior, which is what we do sexually, our identity, which is how we identify our sexual orientation, and our sexual attraction, so who we're sexually attracted to, which might be different than emotional or romantic attraction. And again, it's important not to conflate identity with behavior or attraction, although we often do. So for example, we might be working with somebody who identifies as a gay man, but occasionally has sex with women, right? And it's just important to be aware of this so that we're not making assumptions about people based on their identity or their behavior or their attraction. So I just want to go into a little bit more detail on the terms bisexual and two-spirit. So two-spirit is an English language umbrella term that's used by some Indigenous peoples of Turtle Island to describe gender identity, sexuality, and social roles within Indigenous communities. They're thought to carry kind of both masculine and feminine spirits. The creation of this term is attributed to the elder Myra Laramie at the 3rd annual International LGBT Native American Gathering, which was held in Winnipeg in 1990. So it's a term that can be used to describe both gender identity and sexual orientation. And one of the impacts of colonization is the theft of identity, ways of being, and the loss of knowledge about two-spirit peoples. And this is a source of trauma for Indigenous folks. Some Indigenous people identify as two-spirit and some don't. Some identify as two-spirit as well as being lesbian, gay, bisexual, queer, or trans. And only Indigenous folks can identify as two-spirit. With bisexuality, so I'm not going to go into detail with gay and lesbian because I think those identities are more commonly understood, whereas bisexuality can be left out of the LGB kind of acronym. It's kind of invisible. So bisexuality is also an umbrella term for individuals who are attracted to and may form relationships with folks of the same or of different genders. Folks might also use different language such as pansexual, queer, omnisexual, fluid. And bi folks experience particular types of discrimination, right? So a common one is bi-erasure, which is biases, attitudes, and language that really erase or deny the existence of bisexuality. So you might have heard somebody say they're going through a phase or they're just not really ready to come out as gay yet. And bi folks report disproportionate rates of violence and mental health symptoms compared to gay and lesbian and heterosexual folk. And one theory is because they experience biphobic discrimination from both heterosexual communities and gay and lesbian communities. So I'm just going to check my time here. So hopefully that wasn't too much of a whirlwind and just gave us a little bit of an orientation into gender and sexual diversity. And we're going to switch gears now and talk about what is 2SLGBTQ inclusive trauma-informed care, right? And I imagine that a lot of you believe that it's important, right? Otherwise you wouldn't be here. So first, we can define trauma as both a single incident or as repeated events that overwhelm an individual's ability to cope. And there's growing research that's demonstrating that ongoing experiences of oppression and discrimination, such as homophobia, transphobia, biphobia, may be traumatizing and have negative impacts on mental health. So 2S LGBTQ inclusive trauma-informed care is about shifting the conversation from what is wrong with you to what happened to you, which you may be familiar with as it's kind of like the key piece of trauma-informed care. But here we really emphasize that the what happened to you includes experiences of oppression, violence, discrimination on the basis of gender and sexual identity. So We need 2S LGBTQ inclusive trauma-informed care because 2S LGBTQ folks experience higher rates of childhood and adult violence, discrimination, harassment, poverty, and medical violence compared to heterosexual communities. So just to provide a little bit of a snapshot of this, when we look at the trans community in the US, research has found that over half of trans people have experienced family rejection, physical, verbal, and sexual abuse. In an Ontario study, they found that 20% of trans people experienced physical or sexual abuse on the basis of their gender identity, and 34% reported experiencing verbal threats or harassment on the basis of their gender identity. When we look at rates of violence among lesbian, gay, and bisexual folks, people report elevated rates of trauma exposure compared to heterosexual individuals on the basis of sexual orientation. So this includes more dating violence, more physical and psychological abuse by partners in adulthood, and more experiences of sexual assault in adulthood as well. There's also higher rates among youth, although I don't have the stats here. So as I previously mentioned, 2S LGBTQ folks are diverse, and social location or bringing that kind of intersectional lens matters. So we see higher rates of violence reported among 2S LGBTQ women and people of color, right? So there's the intersection of maybe homophobia, transphobia, biphobia with sexism or racism. And folks' experiences of trauma and their access to services is informed by, all kinds of oppression based on their individual social location. So that includes racism, colonialism, ableism, classism, saneism, and fat phobia, just to name a few. So 2S LGBTQ trauma-informed care is important because traumatization and re-traumatization can be perpetuated intentionally or unintentionally by us, right, as individuals, as service providers within the organizations and systems that we work, if we're not thinking about it and working to create inclusive affirmative spaces. So just to illustrate this, I'm going to read two quotes from a research project I collaborated on. So here we have Rory, a 27-year-old pansexual queer white trans man. And he says, "It was next to impossible to find any support for that, his trans identity. I went back to an LGBTQ-focused mental health service and saw somebody who they told me had a really good understanding of trans identity, and it was the most traumatic experience I've ever had. She looked at me horrified when I came out to her as trans and had no idea what that meant and said, 'We don't know how to help you.' I stayed out of counseling for a while after that." And here we have Jordana, a 29-year-old bisexual Métis cisgender woman, and she says, "The counselor basically said that I should stop dating women, that men are the only choice, and that I should try out religion because that would probably solve my problems and make me no longer want to date women. And she said that my anxiety would go away if I stopped forcing myself to be different by liking women." Right, so I think two pretty clear examples of service providers, organizations that were unintentionally contributing to harm, right, because of a lack of an affirmative, inclusive stance. So it's important to remember that people don't need to disclose their identities for us to work in an inclusive way, just like folks don't need to disclose their trauma histories for us to work in a trauma-informed way. Not all 2S LGBTQ folks have trauma histories or mental health challenges. 2S LGBTQ folks and communities are resilient, right? And they heal all the time. 2S LGBTQ identity is not a result of a trauma or pathology, although there are stereotypes that it is, right? Or not stereotypes, but myths. And 2S LGBTQ identities are healthy, natural, and positive. And when we talk about disproportionate rates of mental health among 2S LGBTQ communities, it's important to remember that it's oppression, violence, and neglect that causes traumatic stress and mental health disparities, not anything essential about being a member of the 2S LGBTQ community. So now to switch gears again and look more specifically at trauma within 2S LGBTQ communities. I'm just going to take a sip of my tea. So trauma is a common experience, as I'm sure many of you, if not all of you, know. And Judith Herman first, kind of articulated that traumatic events are generally denied, repressed, and dissociated at the social and individual level, although they're sometimes briefly acknowledged. And this erasure and invisibility, invalidation, dismissal, or outright denial of experiences of trauma can exacerbate or worsen the impact of trauma on survivors, right? And this has been described as a secondary trauma, right? In research where somebody has been sexually assaulted, if medical professionals or people in their life deny or minimize or dismiss their experience, there's a greater risk of development of post-traumatic stress symptoms, depression, etc. And this erasure, invisibility, and invalidation is of particular importance when we're thinking about 2S LGBTQ folks, because many members of the 2S LGBTQ community experience their identities, right, as being invisible, as being erased, invalidated, dismissed, denied, which can be internalized, right, as feeling less valid, right, as a human being. So there's various types of trauma that are listed on the slide here. Insidious trauma, single incident trauma, complex trauma, developmental trauma, historical trauma, intergenerational trauma, community trauma. In the interest of time, I'm not going to read definitions of all of these types of trauma, but if you go to the website that I've listed there, there's a handout that defines these types of trauma, as well as how we can think about them specifically in terms of their relevance to 2S LGBTQ communities. And I'll also provide a copy to Sarah to distribute to participants of the webinar. But I'll go into a little bit of detail on insidious trauma because this might be new to some folks. So insidious trauma has been defined as the continuous traumatic influence of living with oppression. And that can include microaggressions, right, which people often experience on a daily basis. And microaggressions can be statements, actions, or incidents that are just indirect, subtle, or unintentional, but are discriminatory against members of a marginal group, whether it's related to gender and sexual diversity or another aspect of identity like race or class. So insidious trauma or microaggressions are likely unintentionally perpetuated within the work that we do and within our organizations and systems, right? Because oppression is so ingrained in society. So some examples of anti-2S LGBTQ microaggressions include maybe laughing at expressions of same-gender love or sex, or being uncomfortable with it, a shocked facial expression, straight people using derogatory 2S LGBTQ slang. So within the community, some people might reclaim and use a word that's thought to be derogatory. But if it's taken out of that context, it's offensive. Being told you don't look or act gay as if that's a compliment. Being told that you just haven't met the right different gendered partner yet. Straight people gossiping about who's gay or who's trans. Making stereotypical assumptions, being told that you're so brave for being yourself, using that's so gay as an insult, misgendering people by using the wrong pronouns, asking why there needs to be a pride, and the lack of representation and visibility of 2S LGBTQ people in our history, in the media, etc. Right. And when we think of our organizations, it could also just be a lack of representation, in our waiting room, on our website, not having inclusive intake forms. And so it's important to think about insidious trauma as trauma because discrimination has an impact on mental health. So among trans people and bisexual and lesbian cisgender women, research has found that discrimination on the basis of gender and sexual orientation was positively related to distress and PTSD symptoms. And research that looked at the experiences of gay and bisexual cisgender men found that homophobic and biphobic discrimination was related to greater emotional dysregulation, right, which is often an impact of trauma. And among LGBTQ adults who had experienced trauma, research found that transphobia, biphobia, and homophobia were associated with attachment insecurity, emotion dysregulation, and PTSD, as well as dissociative symptoms. And that last study there was conducted in Ontario. So in addition to microaggressions and discrimination, 2S LGBTQ folks may experience the same types of traumatic events as the general population. Or they might experience traumatic events that are specific to their gender or sexual identity. And if we think about traumatic events that are similar to the general population, such as a car accident, there still might be a unique way that a 2S LGBTQ person experiences it, right? So it's important not to make assumptions about the meanings and the understanding and the experience of the event. So for example, if somebody was in a car accident and the paramedic misgendered them or used the wrong name or didn't recognize the two people in the car as being in a partnership because they were of the same gender, those experiences of discrimination, those microaggressions can kind of compound the trauma of the car accident and add this layer of insidious trauma. Similarly, if the people that were in the car accident, if one has to go to the hospital and their partner's not regarded as family and they can't visit them, right? So even if the traumatic event is something that we feel like we have a frame of reference for, like it's just a fire or a car accident or whatever, it's important not to make assumptions or think that we understand it, because people's identities and social location inform their experiences in the world. And when we look at types of trauma specific to the 2S LGBTQ community, this is by no means an exhaustive list, but it can include physical, verbal, or sexual violence that's rooted in homophobia, biphobia, or transphobia. It can include rejection from one's family of origin. And we do know that we have a disproportionate number of 2S LGBTQ youth that are homeless. It can include having one's identity denied or erased, being rejected from one's community, such as their church, microaggressions, as we just talked about. It can also include conversion therapy, which is the psychological or spiritual intervention to change somebody's gender or sexual orientation, which is currently banned in Ontario, and there's legislation proposed to ban it nationally in Canada. Some immigrants and refugees in Canada have faced persecution in their country of origin because of their gender identity, gender expression, sexual orientation, or HIV status. 2S LGBTQ folk also experience employment discrimination, such as demotions, firings, and unjust discipline because of homophobia, transphobia, or biphobia. And we also see a disproportionate rate of trans people murdered in general, and trans women of color in particular, right? And that's another example of social location mattering and how there can be this intersection of oppression. So when we look at the murder of trans women of color, there's the intersections of transphobia, misogyny, or sexism, and racism. So I'm just going to check my time. So looking now to the principles of 2S LGBTQ inclusive trauma-informed care, we've really taken the principles that you may be familiar with, if you are familiar with trauma-informed care, and tried to bring a little bit of a 2S LGBTQ lens to it. And I'll just read, but they're a bit long. So first we have here acknowledgement. So the first principle of trauma-informed care is acknowledgement of trauma, right? Given that trauma is so often minimized or dismissed, invalidated. So building awareness includes awareness of how common trauma is in general and among 2SLGBTQ people in particular. It includes building awareness of 2SLGBTQ identities and issues from an intersectional perspective, and the types of trauma that folks experience. It's also building awareness among staff and clients of how trauma can impact folks' sense of identity and their sense of safety. It's also awareness of the wide range of adaptations that folks make to cope and survive, right, from a non-judgmental stance. And it's also an acknowledgement of the relationship of trauma with substance use, physical health, and mental health concerns. So another principle of trauma-informed care is to work from a strengths-based and skills-building perspective. So when we see a client in context, right, their whole self, and we also see their strengths, their resilience, creativity, and coping. We're not just looking at the bad things that have happened to them, right? We see them as a fully strong human. So from this perspective, clients are encouraged to name and identify their intuitive, innate, creative, coping, and resilient skills, and to develop more skills as needed. So even self-destructive or maladaptive behaviors can be seen as people just taking care of themselves the best that they can. And working from a strengths-based approach is particularly important for 2SLGBTQ people because folks have often received the societal messages that have framed 2SLGBTQ people in ways that are deviant or pathological, right? Which can kind of erode one's sense of strength. So the next principle of trauma-informed care is safety and trustworthiness. And physical and emotional safety for 2SLGBTQ clients is key to trauma-informed practice because traumatic violence often includes a boundary violation and an abuse of power. So service provision can replicate these power and authority dynamics, which were the original sites of trauma, particularly if we're talking about trauma in caregiving relationships or developmental trauma. And 2SLGBTQ people may feel particularly unsafe accessing services because of the fact that some institutions or professions have a history of pathologizing and or criminalizing 2SLGBTQ identities, right? So when we talk about pathologicalization, like there's a history of that within psychology and psychiatry. Homosexuality has been criminalized. And these historical traumas like have a lasting impact, right? And many folks are hesitant or of accessing services or feel distrusting of service providers because of this history. And so it can be important to kind of sit with those difficult feelings that a client may have without taking it personal and really work to build that sense of trust. And so we can do that through ongoing education, through minimizing power imbalances, through really upholding privacy and confidentiality by being affirmative and inclusive and regarding 2SLGBTQ folks' identities as healthy and as valid, as normal, by setting clear boundaries, by having informed consent, being transparent, being accountable, and when we make a mistake, really being committed to authentic repair. And part of this is really taking the burden of education, advocacy, and awareness off of the client. So we often hear in research that folks have been kind of asked to educate the service providers like to an extent that is not reasonable, and that really takes time away from their sessions to do the work that they want to do in terms of their own healing. So while it's important to be open to learning from our clients and to being corrected by them, like we don't want to do that any more than we would for a heterosexual or cisgender client. And educating ourselves and letting folks know that we might make a mistake and that they can correct us if we get it wrong helps reduce barriers to care and increases folks' sense of emotional safety and builds that rapport that's so important. And the last principle of trauma-informed care is opportunities for choice, control, and collaboration. So 2SLGBTQ folk, or 2SLGBTQ trauma-informed services is about creating safer environments that recognize and foster a client's sense of self-determination, dignity, and control, right? And a part of that is really holding an affirmative stance with gender and sexual diversity. So to do this, we can communicate openly, we can create affirmative and non-judgmental spaces, again, minimizing those power imbalances, allowing for the expression of diverse feelings, like if somebody is feeling like unsafe or like a little bit like, not sure about how safe they are in the space. Yeah, to just really welcome all of those feelings and to recognize and to create space for diverse identities so that people can really bring their whole selves into the room. To also provide choices as to services because, there's no one size fits all, and to work collaboratively with folks. And trauma-informed care can include the involvement of diverse 2S LGBTQ clients in evaluating our services, as well as being represented on consumer councils so that they can provide advice and feedback on service design, on consumer rights and grievances to ensure that there's greater equity, diversity, and inclusion in all that we do. And again, I'm just going to check my time. So briefly, 2SLGBTQ inclusive trauma-informed care is the ability to understand and work with people of diverse identities from a place of respect, of humility, curiosity, and a non-presumptuous stance. And it's the ability to understand and work with folks whose cultures, meanings, and or belief systems might differ from our own, even if we identify as members of the 2SLGBTQ community. Right, and we have heard from people that they worked with a service provider who shared an aspect of identity with them, so they assumed that they would feel heard and understood and seen, and that wasn't the case. So for example, one of my clients, a trans man, before he came out, I was working with a lesbian therapist who really tried to talk him out of transitioning and to instead identify as a butch lesbian, right? Because of her own values and biases, really not respecting his right to self-determination. And I know in my own experience, I've worked with a lesbian therapist that really didn't understand biphobia, right? It would make certain assumptions about my experiences within queer community based on her experiences and didn't really seem open to that feedback. So even if we are a member of the community, it's important to recognize that we have our own biases and values and assumptions. And that's okay, but it's about recognizing them when they come up, learning from them, and then moving forward. And if we make a mistake with a client, to own it, to acknowledge it, to do that repair without putting a burden on the person we've harmed, and move forward. So when do we bring a 2S LGBTQ inclusive trauma-informed approach to our work? The answer is always, right? Regardless of whether or not somebody has disclosed they're a member of the community, whether or not somebody has disclosed that they've experienced trauma. And the reason for this is because it can be thought of as a universal precaution, right? So given that 76% of all Canadians will experience at least one traumatic event in their lifetime, it makes sense to work with everyone as if they've possibly experienced trauma, right? It's just good practice, and it's not going to cause harm to somebody if they haven't experienced trauma. So similarly, if we think about trauma-informed care as a universal precaution, Just the inclusion of diversity is an approach that can be embedded into everything that we do, right? To ensure that folks feel safe and have access to supports and to services that really meet their needs, whether or not we know, the details of who they are and how they identify and their social location. So because we can't make assumptions about somebody's identity, their experiences, their background, we really must strive to work in a way that respects and includes everybody. So just finally now, looking at how do we apply this to practice. And first, I want to say that trauma-informed practice for 2SLGBTQ communities and everyone is an overall way of working, right? So when we think about trauma-informed care or equity and diversity and inclusion, it's really like a paradigm shift, right? So switching that conversation to what's wrong with you to what's happened to you, and looking to embed inclusion, anti-oppression, anti-racism into everything we do. So it's not necessarily a set of techniques or strategies, but bringing these principles to our work, upholding our values. That said, I do have some practical suggestions or ideas that come out of research that the team at U of T has conducted or that Leah Keating has conducted. But I really encourage you to think about it also as a paradigm shift and about embedding values throughout all that we do. So first, with advertising, right? We can place ads in or write articles for local 2S LGBTQ publications, which demonstrate a desire to work with the community in an affirmative manner. In our waiting rooms, our offices, on our websites, we can post a Bill of Rights committing to non-discriminatory trauma-informed care of 2S LGBTQ clients. We could also have information on resources relevant to the community. We can display images that affirm 2S LGBTQ identity. So this could include images of same-gender couples or a rainbow flag. But it's important that if we do this, that it's not lip service, right? That it's not just an aesthetic, but something that really is embedded into the work that we do. Because as we saw from the quote earlier from Rory of accessing the LGBTQ mental health organization, they were transphobic, right? And we've heard that from a lot of people, that they access a space, it has the rainbow flag, they think that it's going to be cool, and then they experience homophobic or biphobic or transphobic discrimination. So it's important that if we're going to, have these visual signifiers, that all staff have been trained in being inclusive and affirmative. And in the waiting rooms, although it's not a thing during COVID, we could have 2S LGBTQ magazines. And when we look at introductions, so whether that's on the phone, intake, the first session, we can ask clients their pronouns and what pronouns they would like us to use in the waiting room or in the presence of family members. This is particularly important if you're working with youth. So for example, one young trans person I work with, I use a certain name and pronoun when I'm with them alone. I use a different one with mom. I use different name and pronouns with dad and the grandparents. And being able to kind of manage all of that and make note of it is so important for creating that sense of safety, right? We can also share our own pronouns. So if you don't already, just including it in an email signature, but also routinely kind of offering that information when you introduce yourself, hi, my name is Jenna, I use she, her pronouns. And have the ability for clients to provide their correct name in addition to their legal name on intake forms, as well as pronouns. And in terms of everyday practices, we can just kind of get into the habit of using inclusive non-binary language. So asking, do you have a partner or partners? Instead of, do you have a boyfriend or a girlfriend? And looking at the language that we're using, like verbally, also on our forms, on our website. And I know when I was recently doing the trainings with the Public Health Agency of Canada project, I recognized that my intake form, I asked for pronouns, but I used the word preferred instead of correct, or not correct, but pronouns. And the issue with using the term like preferred name or preferred pronouns is that it suggests it's a preference rather than it just is, right? So just being aware of kind of the values embedded within language, like a preferred pronoun or a preferred name. So being able to collect and use accurate names and pronouns is a super great habit, and to do that consistently, right? Whether you're face to face with the client or with your colleagues. We can also bring ourselves to the work, right? So this is definitely an individual choice, but if you identify as a member of the community, consider making yourself visible. And we also hear from folks that they appreciate when organizations are involved with 2SLGBTQ community events, right? So Pride events often have ability for organizations to demonstrate a commitment to the community. Ongoing professional development is always a good thing. So you can receive training to build your knowledge, your skills, and your confidence of working with 2SLGBTQ identified folks and with trauma. And to ensure that all staff engage in anti-oppression, anti-racist, and 2SLGBTQ inclusion training. And to not just, like, I know we're all super busy, but not just attend these trainings and then, get back into the busy life as usual, but really consider, what can I take away, right? Like, what are some things I can implement? To all aspects of the work, whether it's policies, procedures, the website, administrative forms, physical space, etc. And self-reflection is super important, right? So being able to reflect on our own assumptions and not assuming that we know somebody's sexual orientation or gender by looking at them. To consider how accessible our practice is and if there's ways that we can enhance access with regards to cost, hours, and location. And reflecting on our own assumptions about gender, sexuality, trauma, mental health, and how they inform our practice. And we're all going to make assumptions, right? As I mentioned before, like, it's how the brain works. But it's important to kind of catch ourselves and correct ourselves. And although I'm bisexual, I have a lot of experience working with the community, like, I make assumptions sometimes. So for example, I have a client who's a bisexual cisgender male. He was talking about struggling with having a different value system than his father when it came to hunting. And my assumption was he's bisexual, so he must be a vegetarian or a vegan and be totally against hunting. And this is like creating some sort of difficulty with his sense of connection to his dad. When really it was that he prefers hunting with a bow and his dad prefers guns, right? And so I was then able to recognize that I have this assumption that connects like veganism and vegetarianism with bisexuality. And I was able to kind of correct that for myself. Right, so the problem isn't that we make assumptions, but that we are self-reflexive enough to catch them and then make adjustments so that we don't necessarily make mistakes, like the same mistake continuously with clients. And continuing with self-reflection, just acknowledging when we're not knowledgeable or skillful in a certain area, and then either build skills and knowledge in that area, which is super preferable, or to refer to somebody who is more skilled, whether that's working with gender and sexual diversity or working with trauma. And it's important to examine stereotypical beliefs that may come up for you, right? So in clinical settings, we've heard clinicians believe that bisexuality is an indicator of promiscuity or an unstable self-image. And so really noticing, right, if there are certain stereotypes that you hold or clinical judgments that you make that may be biphobic or transphobic or homophobic. I'm just going to check time. So finally, looking at cultural humility. So some recommendations here is really understanding insidious trauma. So discrimination and violence because of 2SLGBTQ identity as a form of trauma. Regarding sexual and gender diversity as legitimate. Not assuming that 2SLGBTQ identity is a result of an individual's trauma history. And really creating space for clients to bring their whole self to a session or to our work, wherever we may be, right? And understanding that the sexual and gender identity is only one aspect of their self, and that all parts of their identity intersect to inform their life experience, their trauma, and their mental health. And in our research, we've often heard that people don't feel like there's many spaces that they can bring their full experience, right? Their full self, and be understood as a whole person with all the unique aspects of their identity. Continuing with cultural humility, it's about respecting the historical and contemporary traumas that 2SLGBTQ folks have been subjected to within the mental health field. And the ambivalence and trepidation that they may feel working with mainstream institutions, right? And to create space for that, to be, gentle about it and have that be okay, right? And really work to build that trust and sense of safety rather than expecting it from the get-go. It can also be about noticing if we're bringing gender and sexuality into the conversation and whether the client believes it's relevant. So in that one quote, anxiety was really connected to bisexuality, but Jordana didn't think that the bisexuality had much to do with the anxiety, at least not as the counselor was conceptualizing it. And I think, I work with a lot of members of the 2SLGBTQ community, but most folks don't necessarily want to talk about gender and sexual issues. Rather, they want to know that they're working with somebody who gets them, who understands them, who's going to be affirmative and inclusive, and that they don't have to explain things to me, and that they're at less risk of being discriminated against. Right. And understanding that it can still be difficult to be out, right? Even though the world has changed a lot, it's not necessarily easy to be out. Cultural humility also includes being aware that some diagnostic labels have been used to undermine the legitimacy of trans and bi people's identities, which are seen as less stable because they're non-binary. And this can impose significant barriers to accessing resources. We can make an effort to keep up to date with terminology and issues, language is always changing. We can also develop a knowledge of and affirm diverse relationship structures, such as polyamory, and diverse expressions of sexuality, such as kink or BDSM, like the 50 Shades of Grey stuff. We can let our clients know that they can provide us with feedback if we get something wrong, if we accidentally use heteronormative versus sexist language, that they can call us out on it, and that we're open to learning. We can apologize and move forward. And as I discussed before, being open to learning from our clients, but not expecting them to educate us beyond what is appropriate. So some final takeaway messages. People often feel invalidated accessing services due to inappropriate language, assumptions, and a lack of understanding. And as service providers, we can educate ourselves. We can be open and non-judgmental. We can be self-reflexive and aware of our own biases and areas for growth. And we can affirm different gender identities, sexualities, and the diverse expressions of gender and sexuality in relationship structures. So I have two practical resources for you. One, this is a checklist that Leah Keating and I developed from some of the work that we've previously done in terms of, a conference presentation or webinar on this topic. So if you go to the website there, you can download this checklist, and it includes a list of what I just described here, as long as this area to kind of self-reflect, I already do this, I want to do this, I'm hesitant to do this. And This is much more comprehensive, but if you go to the Building Competence website, which is the website for that project that piloted the trainings all across Ontario, there's a 12-page PDF in the resources section. And what it does is it summarizes the principles of trauma-informed care for 2SLGBTQ folks and how to put them into practice. And then it also makes recommendations for putting this into practice at the individual level, the practice level, the organizational level, the systemic level. So it's much more comprehensive than what I just described here. And hopefully it's of use. I want to thank you so much for your time. And feel free to contact me. And as I mentioned, I am looking to kind of curate an online community with educational resources on this topic. So you can sign up for a mailing list there to receive information on that. And I'll also be communicating the next stages with the grant if it's received through that email list. But yeah, sincere thanks for being here, for being interested in creating more inclusive and trauma-informed spaces. And I look forward to any questions you might have, and I hope that I can answer them.
Thank you so much, Jenna. Just so much information. That's the comments that keep coming. Thank you so much, and so much information that you've provided. And if you can turn your camera on now, if that's okay, we have many questions that we'd like to discuss in this period and hear your responses to. And I wanted to start first with a number of questions, and I'm going to sort of pull some themes that related to language. So people are interested in your input and your perspective on terms to use. So for instance, in your presentation, you chose 2SLBTQ plus, and a number of people shared other acronyms that they have heard, some that they preferred, some that they just knew of. For example, there was 2S plus LBTQQ, and sometimes with a plus on the end of that as well, or 2SLGBTQIA plus, and there were others. And the question for you, the input to start us off is, how did you determine to use the acronym you use? Is there a preference? And what do we know about, is it determined by a particular jurisdiction? Is there a preferred acronym that's used in Canada, or is it community by community? Any thoughts you have around that, I think people would be very grateful for.
Yeah, thank you for that question. I think that language is always shifting and it can be quite regional. And so we chose to use that acronym. I guess it's kind of the norm in Toronto, where a lot of this work has taken place. And in the typically we use the acronym LGBTQ, and I know there's like so many variations. But I think a lot of them get at kind of that same of wanting to create an umbrella acronym that includes gender and sexual diversity. And that plus is used to kind of signify all of the identities, of which there are many, to try to not render them invisible or erase them. Although I think when they're not explicitly named, that is a risk. And we placed 2S at the beginning because with the PHAC project, the Public Health Agency of Canada project, we had an advisory committee of folks from across the province, and from their involvement at some recent community gatherings, I think it was a conference, I can't remember who organized it, but I believe it was national. That was really the recommended kind of preferred acronym. Yeah, but so I would encourage people, like in the reference or the resources, There is some links to glossaries online that provide definitions for a lot of different terms. And it can be useful to kind of read through those glossaries, but also recognizing that they're continuously updated and shifting as things change, language changes, and community preferences change. But there's not necessarily like, this is the one acronym to use. It's just kind of the most commonly used one in Toronto.
Mhm. Thank you for that. And I'm glad you explained the plus. There were a number of questions that what really is meant by the plus in terms of the end of the acronym that you were using. And it strikes me that you don't want to leave anyone out, but the more specific we get, the greater the risk we do leave somebody out in some ways. It's a kind of a catch-22 in terms of how to be most inclusive with the acronym that we choose.
Absolutely.
Mhm. Just staying with language, there's a couple more things that are related to language. One is, how is the best way to ensure inclusivity and proper language use when advertising and creating programming that is gender-based, such as at a women's shelter or a girls' program, both of which would be open to anyone identifying as women, female?
I think that's something that I don't work in the shelter system, but I know that that's a question that we have received a lot of. And I know that there is work being done, and I can email out a resource if somebody wants to connect with me through an organization in Toronto to kind of grapple with this question of gender, how to create most inclusive gender-based programs, specifically in this violence against women sector and in shelter and shelters specifically. So I know some organizations have chosen to include any self-identifying women or just non-cisgender men. And they have recommendations in one of the documents they put together with policies and language around that. And I think it can also be helpful to just bring in outside perspectives, right? And so to really take the time to consciously read through all of our advertisements or other kind of written communication and ask, like, who's missing? And sometimes we have our blinders on, so we don't know. So it can be helpful to bring in like an outside consultant or like an advisory committee of diverse individuals with lived experiences so that they can give their feedback. And I think that's really a huge piece, right? Is involved in the communities that we want to serve and to just ask them for feedback, right? On does this feel like inclusive language to you? What's missing? How can we shift this? To kind of communicate what we're hoping to communicate in an affirmative way.
That sounds like such a good recommendation, and not to make assumptions about what might be most inclusive, but to actually work with communities and get their input. There's another one that really relates to language, and you talked quite a bit about this in your presentation, Jenna. And more agencies have begun to share their pronouns, like in terms of emails, staff that work there. I know when I introduced myself today, I shared my pronouns. And the question is, if people do not need to disclose their identities, is there a concern that this practice might come across as being inclusive, or might it exclude those, especially if you're in an environment where many may identify as she or her or he or him, and other people may not want to share their pronouns, may not feel comfortable, or may feel that this isn't necessarily a safe place to share they, them. So are we helping? Is it more inclusive to do it? Or potentially, are we creating discomfort or exclusion?
Yeah, I think that's a really great question, a great point, and something to be mindful of because we want to increase like a sense of inclusion and visibility and like acceptance without necessarily putting pressure on people to disclose something they're not comfortable with or out themselves. So like in my practice, like I will, have my pronouns in my email signature. I will routinely verbally offer them without necessarily the expectation of somebody replying in response. So not necessarily asking and what pronouns do you use? And it kind of opens the door for somebody to choose to share that if they want, or some people don't even, notice, or some people it flags that I have a certain type of politic or sensibilities that that makes them more comfortable working with me. And again, with my intake forms, like it's an optional, like it's not anything that somebody has to force them, like a forced response. So I just think being open, like creating a space where people can choose. And if we are, like, say, doing a group setting where people are sharing pronouns along with their introductions at the beginning, to have like an option to pass, right? And to really make it clear that people can show up in the way that's most comfortable to them, and that there's no judgment with that.
Very helpful, Jenna. I want to now move a little bit from the language, although we may come back to some more language pieces later on. But I want to move to the types of trauma that you discussed, and in particular, insidious trauma. And I can sense that while some of the types of trauma you discussed are more familiar to people, insidious trauma isn't something that maybe is as familiar to many people. And the question is, can insidious traumas be vicarious or secondhand?
Yeah, I saw that in the Q&A and I was like, I don't know. I think that's a really
I
good
love
question.
your honesty, Jenna.
I think that's a really good question. I think I don't want to give an off the cuff answer, but I think it's something to think about, or maybe like an area for research. And like I know that like I know a friend of mine who is like a queer woman of color, a psychotherapist. Like she has described kind of a vicarious trauma as a therapist, hearing about the racism and the homophobia or biphobia that her clients experience. So I think there definitely can be a vicarious aspect to it, depending on, I guess, how we're thinking about that. But yeah, as I said, I'm not sure totally how to answer that question, but I think it's an important one.
Yeah, and that's the beauty of these kinds of sessions and the wonderful questions we get from participants, because they do make us all think and step back. So I think that's good, and I always appreciate someone who's saying, "I want to reflect on that a little more." It's always refreshing. Just staying with insidious trauma, Jenna, does that mean, given how you defined it, that it makes sense, is the question, that insidious trauma is often present in schools?
I would say absolutely, right? Because I think it's present everywhere, like especially like if we're not aware of our own social location and privilege, we're unintentionally perpetuating oppression in so much that we do, and we're not even aware of it because it's invisible to us. We're not picking up on it unless somebody points it out. So I know one of the comments in the Q&A, like I was getting tongue-tied and anxious and like messing up the acronym, and then that is experienced as a microaggression if I'm leaving out the T, as I was. And so I think like we perpetuate microaggressions all the time, and we're not necessarily aware of it. And our intent might not necessarily be to traumatize somebody or to cause harm, but as we know, intent doesn't always, it's not always aligned with impact, right? And if so, somebody is living in the world as a gender or sexual minority person, they're going to pick up on that, and they have a whole history like of little things in everyday life that make them feel less than. And so it's definitely in our school systems. And although I didn't speak about the experiences of youth, there is a few links on the website with the continuing education resources that talk more specifically about working with youth, children, and families. And if you email me, I know that there is some work that has been done specifically around gender and sexual-based violence in the school system.
Hey, thank you again, Jenna. And on behalf of all the audience, we really appreciate you making yourself so accessible in terms of people reaching out and contacting you and sharing additional information. just staying, you led naturally to the area of microaggressions. And one of the questions is, why is, quote, "you are so brave"? Why is that considered a microaggression? Can you just expand on that a little bit from your presentation?
Yeah. Like when I hear that like I guess like you're so brave, what to me like it's just like I'm just being myself. Right. And like and would we say that to like a heterosexual person or a cis person? And likely we wouldn't, because the assumption is that they're like normal. Right. And so I think there's an assumption within that there's something different about who we are that's less valid or more shameful, to be out and present and visible in the world.
Mhm. Um, Again, that makes so much sense when you share that. Um, Another question that's related to language more is, but also could relate to microaggression through forms, is many people on forums ask people to identify if they're comfortable, and they say male, female, or other. And some people find that offensive. And can you speak to that, and again share some of your thoughts about that language, and why that might be perceived as offensive?
Yeah, absolutely. Like I think that's a great example too of how like language and norms change, because I think like like many years ago that was kind of considered like the thing to do to be inclusive.
Mm,
But like now we know that like that term other can make people feel othered, um, which doesn't feel very great. So it can be, I mean, I feel lucky because I'm in private practice. So I can have very open-ended, like just like gender, like in a fill in the blank, however people choose, like whatever language they identify with. I recognize it can be more difficult in organizations where there's certain like standards or expectations from like ministries they might report to. But I think having, yeah, that term other can feel othering. So if it's possible to just kind of have an open space for people to choose whatever language fits how they identify, or to have just more options. And there are resources that exist, I think from an organization out of the United States that I'll add to the website that's not on there. But there's an organization in the United States that has a PDF that really specifically looks at administrative forms and gives recommendations on gender and sexual inclusion.
okay, that would be very appreciated, I'm sure. Jenna, you talked about traumatic incidents, trauma, and you talk about microaggression. Can you differentiate the two? And or is it simply that some microaggressions may be a trauma for someone, may be experienced as a trauma? Can you just talk to that a little bit?
Yeah, I think it really comes down to the individual, and how they experience the incident. So we know that some people experience like big T, like I don't love that language, but traumatic events, but they don't necessarily present like in a stereotypical way of how we understand a traumatized person to respond. Um, Similarly, somebody may experience a microaggression and it may not impact them um, in a negative or a deep way. It might be something that they just, rolls off the back. For other people, like it may be experienced as a trauma. Um, and it may also be triggering like a whole series of past experiences that it emotionally feels connected to, whether it's like a sense of invisibility or being invalidated. And so I think I think we can't make assumptions about what is and is not like traumatic to somebody. And so it's really important to um, just kind of create space and meaning for people or create space for people to make their own meanings. Um, yeah.
Mhm. You've mentioned that so often microaggressions, we're not even aware, and they're definitely, we don't intend harm. Um, and that may not be true all the time. Some microaggressions may be used knowingly, but given how commonplace they are at this point, um, do you have any suggestions for how service providers can respond or redress an unintentional microaggression? And it may be one that um, the service provider themselves have perpetrated, towards a client, but it might be someone that was in the waiting room, that, spoke in a way that, was microaggressive to an individual, may have misgendered, for example, or made other assumptions. What would you suggest? What are your recommendations for responding or redress?
Yeah, well, I think first, like before kind of speaking to the responding piece, like I think it is so important to regularly um, participate in like anti-oppression and anti-racist trainings, and that includes trainings on 2SLGBTQ folk. Uh, and the importance of these trainings is so that we can continuously get to know our own social location, our own values, biases, and assumptions, so that we can be more self-reflexive and aware of a microaggression when we either unintentionally perpetuate it or if we witness it in our community or in our workplace. So if you haven't already taken these trainings, and they're great to brush up on, even if you've already done one before, it just helps us build that awareness piece. And I think once we have that awareness piece, like so often we can become like overwhelmed with guilt, like if we've caused harm and unintentionally like discriminated against somebody or made like a cis sexist or heterosexist like comment. And I think it's important to, like, from a trauma informed perspective, to be aware of our own like stress response when we mess up, to have those emotion regulation skills to calm ourselves down, stay present, not make the whole situation about us and our discomfort, but instead respond in an authentic, compassionate way, and apologize, and if we need to, if we're the one that has caused the harm, but to not kind of put the onus on the individual that we've microaggressed to take care of us, to just have that authentic repair, and then move forward and commit to not making the same mistake again. Because I think it's okay to make mistakes, but it's not okay if we constantly make the same mistake over and over again, because we're not necessarily internalizing that learning. And I think if we witness a microaggression, just getting comfortable to have that confidence and the voice to name it, and not in a shaming or blaming way, but to name it and to look at how can we prevent this from happening again, right? And if we witness something in a waiting room, like creating spaces for teams to maybe anticipate these kind of situations. So if this happened, like how would we respond? Because I think having that planning or preparation can help, rather than kind of maybe being caught off guard in the moment and not knowing what to say or do.
Jenna, in people's personal lives, or they may be educators on behalf of their organization, they often run into individuals in an audience or online who may take the stance very strongly that 2SLGBTQ plus is not natural. And the question is, do you have any suggestions or advice on responding, how to navigate and handle that in a most effective way, um, from your experience?
Yeah, I think that's a challenging question. I'm lucky I don't have personal experience navigating that, but I've mostly worked with queer teams. Um, uh, I think it's about a commitment to inclusion, diversity, and equity within our organizations. It's like a core set of our values, and then really being committed to uphold those values. So I know. And I think it can be important then to have diverse folks in the work culture, or like on consumer advisory committees that are compensated for their time to provide that feedback to making sure that we are upholding the values. And it's also like a human rights issue in Ontario, right? So for example, I know one of my ex-partners was on a hiring committee of an addictions and mental health team, and they made sure to like routinely ask questions like about how you would work with somebody who was like a member of like the gay community, for example. And I remember them sharing that one of the people that applied for the job like gave a really homophobic answer. And nobody picked up on it except for my ex, because they were a member of the community and nobody else on the team wasn't. So I think it's important to really be clear on what our values are, to be clear on like what it means to like live out those values, to provide space to build people's knowledge and confidence and skills, as I mentioned, like the anti-oppression trainings. And then to, when we're hiring, like assess whether people that we're hiring like are aligned with the values of the organization. And to include, diverse voices within our community that can give that feedback and pick up on things that we might not.
Jenna, I am sad to say we have to bring this discussion to a close. We could go on. There are other amazing comments and questions, but we've run out of time. I want to truly thank you, not just for your presentation that was full of knowledge and insight, but for your the way in which you responded to questions, your sincerity, and your sharing of your own knowledge and experience. We truly appreciate that. And I know that people are going to be so pleased with the resources and the links that you're providing. And the website is just full of good information. So people will be able to follow up. And you've also said if they want to contact you and you provided your contact information, that you'll try to link them to resources that they may need.
Absolutely. Like if there's any questions or like looking for a specific resource, I'm happy to be contacted and share whatever I can.
Thank you. And I want to thank our ASL interpreters from the Toronto Sign Language Interpreters Service. Again, our apologies. I can't tell you what it means when we're in a learning curve and make mistakes, and you're so generous in your acceptance and again asking us to learn as we go forward, which we promise to do. But we just wanted to reinforce our thank you and appreciate both of you so very much. So with that, please remember to do the evaluation. The link is in the chat box, and that helps us to make decisions about future webinars. And again, thank you to everybody who joined, and to the team that behind the scenes have been answering some of your more technical questions. And we look forward to seeing you again in the near future at a future webinar. Bye for now.